So Carl came in with something that's called GBS, or Guillain-Barré syndrome. It basically attacks your nervous system. So he is slowly working on regenerating his nerves. He went from being walking, talking, fully functioning father, husband, and full-time worker to being completely, essentially, a quadriplegic and having no movement.
A lot of it's quite weird, like learning to use your hands again, slowly learning to use the legs again, and just like things like holding something, and it's a huge task just to not drop an object or things like that. You have to really focus hard on every small task.
The reason that we're into recreation and leisure are looking at overall well-being, and for everyone that's different. Sometimes it's a matter of that meaningful activity helping them overcome their illness or their injury. It can be an outlet for them. I've had patients do the gaming that were super frustrated with their abilities, and when they can actually do something that they used to do and do it well with the proper setup, it's a huge win for them that all of a sudden they can still feel like they are themselves and they're connecting with their own identity versus being their injury.
Gaming is the largest entertainment industry in the whole world. There's lots of folks that either now can have access to it through accessible devices, accessible resources, those kind of things, or if someone is a gamer and then maybe has an injury and then wants to return back to gaming. So that's like a huge portion of maybe how they're interacting with their community. So, interacting with their friends, interacting with people online. So gaming is really important that way, as well as in rehabilitation too. So if someone is consistently using switches, consistently using joysticks, that can help them both, create, muscle tone or help them with their specific disability as well. The controller by definition is like one size fits all. Everyone's going to pick up that controller and be able to use it. Well, not everyone, right? So that's the kind of element there is we want to use all of this technology, the software, the adaptive technology, the modified controllers, all of those pieces to create someone's new setup. So, instead of picking up maybe a standard Xbox controller people be familiar with, they're picking up a lap tray that has a bunch of switches and joysticks on it. So we just want to make sure that they have a setup that works for them the same way that a standard controller would work for someone.
You go in there and you're just like, you're not a guy in a wheelchair, you're just whatever you're doing in the game. You're just kind of getting back that little piece of something that you lost.
Sometimes that recreation and leisure is not necessarily about returning to them that right away, but giving them again an outlet, something for that mental well-being and a coping mechanism to help them manage that illness adjustment and move forward.